So presently in Lee County, we are at an all-time high for the pandemic with the number of people hospitalized as well as the positivity rate and the number of positive tests being done at all the different testing centers in the area. So we expected this surge post-Christmas. We still haven't seen the full effects of post-New Year's. So over the next 2 or more weeks, the expectation is things are going to get worse. And that's part of why we made some of the decisions we've made with regards to employees returning and the start of school. So the best practices that I think that we all need to participate in, whether you're a student, a faculty, a staff member, is number one, wearing a mask. Number two, sanitizing your hands frequently, whether through hand washing or using hand sanitizer. Number three, whenever possible, avoid close distances with people, wherever you are and whenever you are. And then finally, using that GuideSafe daily app for you to consciously go through what symptoms you're having day in and day out and from day to day, which will help give you some idea. I can't tell you how many people towards the late fall thought they just had allergies or thought it was just a simple problem or maybe a mild sinus infection, and they all came up positive for COVID. So, if you, again, intentionally think about what's going on with yourself, then it's more than likely you will pick up COVID early or find out that you don't have it, and that way you will help protect yourself and the people around you. So a very important part of our strategy of, again, getting through this next semester is going to be the sentinel testing, which is going to be done locally, in-house, at Auburn, through the Harrison School of Pharmacy. And so that sentinel testing is going to be done every week. People will be randomly chosen. You will get an email which is asking you to voluntarily please come and get sentinel tested. It is an important mechanism for us to have a good idea of what is the prevalence of COVID in our community, specifically campus community, as well as are there any areas of concern that we can identify early and begin the process of mitigation specific to those areas of concern. We're anxiously anticipating the arrival of vaccine. There's absolutely no barriers to us receiving vaccine from the Alabama Department of Public Health. We've requested the allocation. We have an ultra cold freezer. We have a refrigerator. We can accept either type of vaccine that's available right now, and they're aware of this. But unfortunately, the rollout of vaccine coming from the federal government to the states has been slow, and that's affecting our delivery. So as soon as we get vaccine, I guarantee you we're going to start administering them. The goal here is not to hold on to any doses. The goal is to give out every dose that we can as quickly as we can. So because of this peak and surge that we're going through, all the local testing centers and their phone lines, everyone is busy. Everyone is doing the best that they can. Nobody's trying to hold back on testing people, but everyone's busy. So please be patient, but be persistent, okay? Nobody's trying to avoid answering your phone call or returning your message. Just there are literally hundreds or thousands of calls coming in to multiple testing centers simultaneously, and we're trying to serve everyone we can.